Imagine there is an outbreak of measles in your area. Without an effective surveillance system in place, cases could go undetected and unreported, and the disease could spread before you take action. Surveillance is a critical part of every immunization program. It helps guide disease control activities by detecting cases, detecting and confirming outbreaks, identifying high-risk groups, taking corrective actions, and monitoring the impact of immunization services. As a district or subnational manager, you need to implement an effective surveillance system throughout the health facilities in your district according to national policies. To implement an effective surveillance system, you will need to recognize the objective of your program for each disease, consider the surveillance methods for each objective, and support staff to carry out surveillance. First, recognize the objective of your surveillance program for each disease. Remember, there are three main types of disease control objectives: control, elimination, and eradication. The goal of disease control is to reduce the disease incidence or mortality to a level that is locally acceptable. In other words, immunization and other interventions are used to reduce the number of disease cases. The goal of disease elimination is to reduce the incidence of a specific disease to zero in a defined area or to a very low level of incidence, as for neonatal tetanus. And the goal of disease eradication is to reduce the worldwide incidence of infection to zero and completely eradicate the causative agent so that it is extinct. This means that there are no longer any cases of the disease worldwide, and the pathogen that caused the disease no longer exists. The objective depends on the disease, and sometimes on your national and regional goals, which you may have to adjust based on the size of your district. Next, consider the surveillance methods for each objective, since the method requires certain procedures, resources, and staff. There are three main types of surveillance: passive surveillance, the regular reporting of disease data by all institutions; sentinel site surveillance, in which only selected sites identify and notify on certain diseases; and active surveillance, which involves visiting health facilities, talking to healthcare providers, and reviewing medical records to identify suspected cases of a disease. These surveillance methods are covered in a separate video. The method you use will vary by disease and is determined by national policy. Finally, support staff to carry out surveillance. Work to build cooperation from health facilities. Emphasize the importance of surveillance data from each and every facility. Provide on-the-job training to make sure staff know how to detect, investigate, and report disease cases, as well as the frequency of reporting. Confirm that health facilities throughout your district have and are familiar with accurate standard case definitions of each disease. Train health facility and district staff to collect and analyze aggregate data that summarizes all disease cases in one form. Recall that aggregate data is generally used to report monthly data in passive surveillance systems. Also, train surveillance staff to gather case-based data to provide a more detailed view of individual cases. This data, found in line lists and case investigation forms, is used for diseases that require urgent action, such as confirming cases and outbreaks. Continue to review and provide feedback on surveillance data, both during and between visits. Now you know how to implement a surveillance system.